I'm Dr. Ange Mack. Welcome to Your Health, It's Personal, a Comcast show that focuses on your integrative holistic health and therapies out there to help you improve your quality of life and live to your greatest potential. Today we have with us Mr. Bill Reddy. Thank you for coming and joining us today. He is an acupuncturist working at Inova Hospital System, former aerospace engineer, and I'd like to say how wonderful it is to find healthcare providers within a normally traditional healthcare setting like Inova Hospital doing acupuncture and those types of therapies, now proven to be extremely effective. Bill, welcome to the show.
Yeah, thanks so much for having me.
Yeah, thank you so much for being on with us. So I'm fascinated about the work that you do there within Inova. I know we've talked and you said you have clients that are both physicians and healthcare providers, as well as those that just come in wanting acupuncture. Tell us a little bit more about, what you do there, what your purpose is and your job function, as well as the outcomes that you're receiving from the people that you work with.
Sure. So the traditional Chinese medicine and acupuncture has been in Inova system for about 10 years now, 11, I guess now. And I do what typically private patients do, private practitioners do, in terms of seeing patients with everything from low back pain to migraines to infertility. And the outcomes are pretty tremendous. There's certain things that acupuncture doesn't work for, and I make sure that those patients don't come in to see me.
That's fabulous, and I'm sure you're providing a huge benefit to those. I also understand that you work with physicians on staff, both nurses and doctors, and help with this resiliency piece that healthcare providers are struggling with right now, just from the overwhelming amount of work that they're doing right now during the pandemic. That has even increased with regards to all of the protective gear they have to wear and the long hours. And tell us a bit more about the physicians and the healthcare providers you work with, and how you're providing acupuncture to help with that resilience.
Well, so the number of physicians I have are very few, just because my hours are Monday through Friday, 10 until 6. So they're working when I'm working. But I have quite a few nurses that roll on in because they have 312s, and so they have 4 days a week that they're not working and have the flexibility to see me. I have a few ER nurses that, of course, are really on the front lines, and I help them with stress and fatigue and sleeping well and just general overall well-being.
The resiliency piece is critical, and they are very fortunate to have you there in the building and able to work on them when they can break free to receive some of your therapy and your acupuncture. A fun fact I was curious about, and we talked about a little bit previously, was the fact that you were an aerospace engineer, former to kind of completely doing, looks like a 180 in your career, now doing acupuncture. What brought you from doing aerospace engineering into this field of acupuncture?
I really enjoyed engineering. It was intellectually engaging and it was fun, and I got to play with a lot of toys. I flight tested helicopters and I put satellites up in space. However, at the end of the day, there's something missing. I felt like there was something that I could do more for people, and I was misdiagnosed with a brain tumor when I was 26, and it changed how I viewed my life, and decided to change careers and become an acupuncturist.
Your story is beautiful, and it's not uncommon amongst healthcare providers that I run into that have switched and refocused their energies on a more integrative, holistic, patient-centered approach to care. Something traumatic happened in their life, and they realized there was more they could be doing, and they could be doing medicine and healthcare better. And they just realized, kind of like you, well, it's like there's something missing. Why, I'm not practicing the way I would like to, or I'm not doing what I would like to in this lifetime. And they've kind of switched gears and are now, doing more integrative health therapies like you are, which I believe is absolutely fabulous and so much needed in today's time, when we're more reactive in medicine and focusing on once someone gets a disease, opposed to let's keep them healthy to begin with. And that's kind of the whole philosophy behind integrative care like we do. The other interesting piece is that I know you've been working in this field for how many years now?
A little over 20.
a little over 20 years now. And over these years, we've seen shifts in policy and research around acupuncture. Tell us some of the latest and greatest evidence-based research that has come out and how that's impacted what you're doing as an acupuncturist, and what our clients and patients are able to receive.
Sure. So in the past 30 years, we've been very well studied at NIH. There's about 30,000 studies on acupuncture, oriental medicine, moxibustion, and some of the other tools that we use. And that in the past 5 years, of course, there's been some really incredibly good large-scale studies that have been performed with common conditions like low back pain, migraines, neck pain, etc., and that even things like allergic rhinitis. And so the World Health Organization plus NIH both very much support the use of acupuncture in the US. And the FDA came out with a pain management blueprint strongly recommending acupuncture as a first-line defense against acute and chronic pain. And there's been a number of other, the CDC came out with the opioid prescription guidelines, HHS came out with pain management best practices, and that one also specifically pointed out acupuncture as a non-pharmacologic approach to pain. So we're really expanding. And when you ask about how many of us there are across the nation in hospital systems, the top 10 hospital systems all offer acupuncture.
Which is a huge, huge movement and shift for, for what we're trying to do with regards to prevention and a non-pharmacological approach to health and healing and recovery. I know our opioid crisis has really forced us to look at additional therapies to pain. And now that policy has actually shifted to support reimbursement with regards to insurance, which has always been a huge challenge and a holdup to acupuncture therapy, now being able to accept that. So some huge movements forward. Unfortunately, it came at the heels of our opioid crisis that's been going on the past few years. Well, it's been going on for a long time, we know, but it's been really getting the attention the past few years with regards to suicide and addiction. So, thank the acupuncture community and those other integrative providers that have been focused on seeing this change through. It hasn't been without a lot of effort. And you mentioned that Medicare is now actually covering acupuncture. That's correct?
That's correct. Since January of 2020, they let that go on. And I was involved in some CMS discussions on that. And they were just looking to make sure the evidence base was solid enough to make that decision. And then they're going to move forward. And I'm hoping to see a lot more conditions being covered by Medicare.
So right now, Medicare is only covering low back pain. Is that right? And we're hoping for an expansion?
That's correct. That's where it stands now.
Well, you have to start somewhere. So, and back pain is, is a critical need. And I'm sure one that people have been taking, all kinds of pain relievers for over the years, and to get something that you can go into once a week, once a month, and have it help with their back pain, opposed to, having to take a pharmaceutical. Yeah, all the better for sure. Now, with regards to, you and your work there at the hospital, I know you said you work with those staff. If someone wanted to, let's say, get an acupuncture appointment with you, can they come in off the street? How would they make an appointment to do that?
So we have both a website that's under Inova Well, and we also have a phone number that they could call. Should I give the phone number? I don't
Sure.
know what.
Give it away.
It's 571-472-1680. I'll do that once again for those scrambling for a pen. It's 571-472-1680. And, and the initial appointment's usually an hour and a half, where I get an idea of who, what, when, where, and how many times do an intake. And then the subsequent treatments are an hour long.
We talked about different conditions or areas of pain that acupuncture can help with. With the older community, we have issues with balance, we have issues with arthritis. How does acupuncture help us in those things?
So one of my professors, his name is Dr. Lixing Lao, did an amazing study about 25 years ago on knee osteoarthritis, and he found out that we were 88% effective to treat knee osteoarthritis. So in the Western medical community, osteoarthritis is the gradual degeneration of articular cartilage. And so it only goes one way, and that's down. However, in the acupuncture field, we recognize that if your body can crumble your cartilage, your body can actually rebuild it as well. And so that's what we found is happening. And we have basically 9 out of 10 people get better with knee osteoarthritis.
So you're saying our bodies can actually rehabilitate, regenerate um, bone loss, cartilage, and collagen?
Yes, it's not actually surprising in that every molecule of your bone that's in your body today is not the same from 7 years ago. So bone remodeling is happening daily, and the same thing is true for chondrocytes that are building cartilage as well.
Which is fascinating. And I think people don't always realize that. They think once they're on that road of arthritis and degeneration that they're stuck on that downhill road. And what we're finding out now is, we don't have to be. We can actually get better and feel potentially better than we did 10 years ago if we were suffering 10 years from this. So that's wonderful news for all of us looking to be, jogging, hiking, walking, into our 70s, 80s, and 90s. That we don't have to slow down as much as we thought we might have to, and we can just keep on trucking, which is fabulous. One of the things I always like to ask my interviewees when they come on, my experts in the field, is just a remarkable story that you've been a part of with regards to your acupuncture and the clients you've worked on. Is there any one case, I'm sure you have hundreds, but is there any one case you'd like to share that really kind of helped a patient and helped you with regards to how you treat and how you understand your work and the benefits?
That is an evil question because I agree. It's like someone handing you an encyclopedia and saying pick a page. It's really challenging for me. There's I'd say that there's days where miracles occur. I just had a patient who has peripheral neuropathy for years, and this is his third treatment, and he said that he can feel his feet again. And so that's unusual. And I'm really pleased to hear that, but it's not status quo. Again, with the arthritis uh, example, it took 10 years, 20 years for the cartilage to start to deteriorate to the point where you're feeling pain.
Mhm.
And so 3 treatments is not going to make it go away. But typically, what the studies show is, 6 months of treatment, for instance, that will be enough to have a long-term effect. And when I say long-term, I mean more than a year.
Right. Miracles do happen, and it's fabulous that that's working for you and for your patients that come in to see you. Let me ask you this. If someone wanted to come and see you and they were not sure if acupuncture was the right course, for them, what could they look into? What could they research on their own? Because a big part of my show is giving people the tools and the information so they can research on their own what's best for them and potentially, search out other providers if their primary care isn't well versed in some of these therapies.
So there is the Acupuncture Evidence Project, and I believe that's the name of the website, Acupuncture Evidence Project. The colleague of mine, Mel Hopper Koppelman, and she's brilliant, and she has collected a lot of data so that if someone wonders, I have osteopenia, is that something that acupuncture can help? Or I have low blood cells from chemotherapy, and they can look that up and find that yes, there's 6 studies in the past 10 years that support the use of acupuncture. And in some cases, the end result would be, well, more studies are needed. So we're not there's certain conditions like a spinal stenosis where there's the there's calcifications in your spinal cord that squeeze the nerves, and that's very structural. And so acupuncture really does not help that, and it wouldn't be very helpful. Yeah.
Interesting. And I think that's critical for our viewers, because knowing where to go and trying to find out what research has been done so they can, educate themselves on what's going on is a fabulous tool that we can give them, and extremely, extremely helpful. Before we close out today, I just want to talk a little bit about collaboration. Acupuncture, is one of, many, many types of therapies. With acupuncture, is there anything additional that you want your clients to, search out for themselves? Does it all depend on their condition and their goals? How do you determine, what else to talk with your client about? I mean, because we know um, nutrition, the proper nutrition and activity, those are always absolutes. Is there anything else?
So, in my opinion, just like any other functional medicine physician or someone who's a holistic practitioner, we're going to look at a couple major items beyond just, oh, my shoulder hurts. And that would be, how well are you sleeping? What do your stress levels look like? How's your digestion? And if people aren't digesting their food properly, then they're just not going to be very energetic. They won't have pep in their step. If they're not eliminating well, if they're only having one bowel movement every 3 days, then that can be really problematic. And they're basically circulating sewage in their blood. It's a little extreme example, but they're thinking clearly. They're just not feeling well. So that's kind of the broad spectrum things that I make sure that my patients are doing well is exercise, nutrition, diet, and and sleeping well.
Circulating in your system. That's an interesting visual. So, but very, very poignant. I think point taken there. So we don't want to be constipated. So that's something we need to make sure we focus on. And I know the university, George Washington University, has an integrative medicine program where they actually train physicians on how to do integrative holistic care, and then you can get boarded in integrative medicine as well now. So the whole field of integrative medicine, that includes, acupuncture and nutrition therapy, functional medicine, is really coming to the forefront here in the U.S. Other countries have been doing this for a long time, looking at all the different aspects that affect your health. It's not just, what's your blood pressure and what's your sugar level and what's your body mass index. It's so many other things. Like you said, it's your sleep. It's how well you're digesting. It's your stress level, because if you're stressed, you're not going to be digesting well, and you may not be sleeping well. So it's like all of these things together make up our whole person health. And I'm so thankful that you were able to come on the show today and share with us what you're doing there at Inova Hospital, what you're doing for the healthcare providers, as well as people who may want to come see you that may not be part of the hospital system. And they can you gave the phone number earlier, and we'll provide that later in the show, as well as a point of contact and the website, so our viewers can reach out and find you if they want to come and seek, or even, have a question to see if this is right for them. Bill, thank you so much for joining us today on Your Health. It's Personal. Any last words you'd like to leave us with?
Sure. I think that integrative health is the real future of healthcare in the U.S., and that really it takes a village, and to have multiple practitioners working with you, whether they're a PT, OT, acupuncturist, massage therapist, naturopath, homeopath, chiropractor, any of those, are great non-pharmacologic approaches to your condition, and that, that's what we're here for, is to support and have optimal health.
Yeah, I love that, to support and have optimal health. So on those words, thank you all for joining us. You can see this video via Comcast or YouTube, Dr. Ange Mack. And if you have any questions, feel free to reach out to me or Bill, and we look forward to seeing you next time.